I got into pain medicine because of my grandparents. I was always thinking of becoming an emergency medicine doctor. I started in high school as an EMT and worked throughout college as an EMT at night. And during that time, I was taking care of my grandparents, and they were in their 80s. And once my grandmother had sciatic pain, you could see that, she wasn't herself anymore. But eventually she reached a physiatrist, a spine physiatrist that helped her with injections, and that really helped her. And I felt like that was something I wanted to pursue. My name's Jerry Fang. I'm an interventional spine physician, and I work at Signature Healthcare. I think I have a very diverse background, and I think bringing all that I learned together helps me treat patients the best way in their spine care. Having a background in rehab medicine and having a specialty training in pain medicine, it allows me to understand the physical mechanics of the back and allows me to have a background in treating the opiate crisis and learning to move away from opiate medications and finding alternatives to treating pain in the lower back and in the neck. I guess what would be surprising to patients is that I'm a complete opposite of what I was as a kid. I was a very bad kid. I'm the nicest person, but before it wasn't like that. And I think part of it was because of my grandparents. I'd taken a caretaker role when I was in middle school, high school, and more. And when you start taking responsibility for somebody else, you kind of grow up. My philosophy for patient care is to do anything to get them better. Anything in my power. I try to treat my patients as personally as possible and get to know them, get to know their family, and understand what kind of drives them, what goals they have, and what drives they had so that I can figure out ways to help them have the motivation to get better.